Parkinson's disease drugs. In this video, I will go over pharmacological interventions for Parkinson's disease. There is no cure for Parkinson. Treatment is mostly focused on symptom management. Please watch my last video for signs and symptoms of Parkinson's disease. Most Parkinson's drugs are effective for the first 3 to 6 years before the disease progresses and becomes harder to manage. Parkinson's drugs are focused on increasing dopamine level and decreasing acetylcholine level. Carbidopa Levodopa, also known as Sinemet, is the most common first-line treatment for Parkinson's. It is a 2-drug combination with levodopa as a precursor of dopamine. Levodopa gets converted to dopamine in the liver. However, most of the converted dopamine gets metabolized before it can reach the brain. This is when the second drug in Sinemet, Carbidopa, comes to play. Carbidopa helps to prevent the breakdown of levodopa so that it can reach the brain and take effect. Levodopa helps to decrease bradykinesia, which is the slowing of movement in Parkinson's discussed in my last video. Sinemet is taken multiple times daily because it has a short half-life and should never be stopped abruptly because it can lead to akinetic crisis, which is the complete loss of movement. Prolonged use of levodopa can result in an on-off effect in which there are spontaneous involuntary movements due to levodopa wearing off early before the next scheduled dose. Educate patients and caregivers to report this to providers so that they can adjust the doses of Sinemet. Also, educate patients and caregivers that Sinemet takes several weeks to reach its maximum effect, and that there may be discoloration of bodily fluids, such as urine and saliva. These are expected findings, and no need to report. Avoid taking Sinemet with high-protein foods because levodopa competes with other proteins for absorption and can decrease its effectiveness. The next category is dopamine agonist. Dopamine agonists mimic the action of dopamine and inhibit the metabolism of dopamine. They are often used in conjunction with levodopa to reduce the on-off effect. They are also used alone in younger patients diagnosed with Parkinson's for the first few years. Examples of dopamine agonists include pramipexole and apomorphine. One adverse effect of dopamine agonist is excessive impulse behavior such as gambling, shopping, sex, or eating. This is thought to be due to overstimulation of dopamine receptors in the area of the brain responsible for instant gratification. Another 2 categories of drugs that affect the dopamine level are monoamine oxidase B inhibitors and catechol O methyltransferase inhibitors. They both inhibit the metabolism of dopamine in the body and are used as complementary drugs to levodopa. Examples of MOA-B inhibitors include rasagiline and selegiline. MOA-B inhibitors have many drug interactions and may cause a hypertensive crisis when taken with stimulants such as over-the-counter cough and cold medicines. COMT inhibitors, such as tolcapone and entacapone, may cause damage to the liver. So, monitor for signs and symptoms such as jaundice or right upper quadrant pain. Take with food to minimize GI upset. The last category is anticholinergic, which include benztropine and atropine. Anticholinergics block cholinergic receptors and decrease levels of acetylcholine, which help to reduce tremors and drooling in Parkinson's disease. One important thing to remember for anticholinergic is its drying effect on the body. It blocks the parasympathetic system and causes dry mouth, blurry vision, urinary retention, constipation, and restlessness. Anticholinergics can precipitate acute glaucoma and are contraindicated in those with a history of glaucoma. Routine eye exams to monitor intraocular pressure are needed. In summary, Parkinson's drugs are focused on increasing dopamine level and decreasing acetylcholine level. Carbidopa Levodopa is the first-line treatment for Parkinson's. It is taken multiple times daily. Prolonged use of levodopa can result in an on-off effect, and this should be reported to the provider. Educate patients and caregivers that Sinemet takes several weeks to reach its maximum effect, and avoid taking Sinemet with high-protein foods. Avoid cough and cold medicines or herbal supplements when taking MOA-B inhibitors. Anticholinergic reduces tremors and drooling, but has a very drying side effect, and patients should get routine eye exams to monitor for glaucoma.